Hi, welcome to Neighborhood News. Today on my show, I'm speaking with the Visiting Nurses Association of Southeast Connecticut, and I'm pleased to have as my guests Mary Lenzini, who's the CEO, and Judy Elwood, who's a nurse, who also is a nurse at the Pawcatuck Neighborhood Center. Thank you for joining me today, ladies. Mary, I just found out before the show, has been in her role or in a leadership role of this organization for 39 years. So we're very lucky to have you talk about the history and the changes that you've seen at the VNA. Could you give us a little bit of a history of, it's a nonprofit organization,
Yes.
and how it started?
Sure. Actually, Connecticut's a unique state in that being as parochial as it can be, each town had their own way of providing community nursing. You can think of it that way. In our area, the New London VNA was the oldest one, founded in 1909. So there was a VNA in New London, and there was a public health nurse in Waterford, and several public health nurses in Groton, et cetera. So over the years, as insurances and Medicare came in, the regulations over how to provide public health nursing or community nursing started to gravitate toward a model that really requires a larger organization to be able to provide all of the services that are necessary. So mergers have happened. Our last official merger in the area was when the Stonington VNA in 1998 joined with the VNA of Southeastern Connecticut.
And at this point, how many employees are working at the VNA?
We have about 240 employees.
Wow.
They are home health care, skilled professionals, and home health aides. So we have nurses, physical, occupational, and speech therapists. And then we have registered nurses. The home health aides are the same as a CNA would be in a skilled nursing facility. Many of our home health aides have their CNA credential. And then we have 2 social workers also that assist patients.
Okay, so I think when most folks think about the VNA, we think of the nurses and the medical professionals going out to the homes. And I thought it would be interesting to have Judy on because you also go to places like daycare centers and senior centers. So you're at the PNC. And Judy, you do our wellness clinic and also our foot clinic. And I was wondering if you'd like to tell the folks at home, if someone goes to a wellness clinic, what exactly happens?
Well, it varies on the individual who's coming and what their concerns are. It may be something as simple as taking their blood pressure and helping them with their lifestyle to help their blood pressure remain stable. We many times will discuss their diet, their exercise, the foods they're eating. And another big thing that I'm finding now is the stress. There are so many people under such stresses now that this does seem to have a big part of why their blood pressure is increased. So we'll set, many times that's what the patient really wants, is just someone who will listen to them and give a little advice, but mostly it's just having a good listening ear and being able to be a little support to them.
And you actually have very nice, long-standing relationships with a lot of the PNC clients that you see. I know you've been there for a few years. You're also at the Groton Senior Center?
I cover a little bit at the Groton Senior Center, but we have another nurse, Debbie Lorick, who does mostly the Groton. I go to Waterford and do the same thing that I do at Pawcatuck Neighborhood Center. Then I do cover in some of the other senior centers when the need arises. But basically we do the same thing, listening to patients. When it comes to our foot clinic, we do have the one at Pawcatuck Neighborhood Center. I do one in New London. In fact, I left there today. I did my New London foot clinic this morning.
Well, thanks for coming right after that.
Oh, you're welcome. And we now still have one in Groton and East Lyme. The Pawcatuck and the New London are run by grants, so this is no charge to the patient. But the the Groton and East Lyme, there is a slight fee
A slight fee
But
to help
to help
pay for that.
Pay for the
with
cost.
with the cost of that.
And with the foot clinic, you were talking about your relationship and having a chance to listen. It seems like you probably have more opportunity to talk to the patient because it's about a half an
Half an hour
that
per
someone's
person.
soaking their feet, right? And so what happens when you go to the foot clinic?
Well, a lot of times, these people become my friends because I see them. They come back 2 to 3 months, depending on what our schedule is. But over a period of years, you really get to know these people. Again, most of them are elderly. They live by themselves, and they're kind of lonely. Not all of them, but a lot of them have lost either a husband or a wife, and they're on their own. And for them to be able to just sit, have somebody soak their feet, talk to them. At the end, we massage their feet, which seems to be something that they really do appreciate.
Who wouldn't like that? That's
So
very
they do.
nice.
They become
Yeah.
more of a friend. And I feel like this is probably my favorite thing that I do because it is so gratifying. And I can see just by looking at the people how much they just appreciate having somebody cut their toenails because they can't see and they can't bend. And as much as their families might really love them, there's something about cutting people's toenails that a lot of people they just don't want to do that. So
Well, that's the amazing thing about being a nurse. You do a little of everything. It's a calling to be a nurse, and I can say, Judy, people love you. You're really a wonderful nurse, and we're lucky to have you at the PNC.
I love them too. I really do.
So you spoke a little bit about cost. So I'd like to ask you, Mary, how does someone afford a visit from the VNA? Do you have to be referred from your hospital, or how would that work?
You can be referred from your own physician, from the hospital. If you've been an inpatient in the hospital, there is a case management department that's responsible for referring you if you have needs when you are discharged. You can also call yourself to the VNA and talk with our intake nurse. We have a couple of intake nurses. You can have a chat with them and try to express what it is you think you might need help with. And in that case, the nurse will talk with you about what services might be available. We still do need a doctor's order, but we can sometimes help you get that doctor's order. If you'd like us to call your physician and talk about what services we think you need, the physicians usually will provide those orders so that we can get you set up in home health care.
Okay, so right now Frank has he just took it down, but there it is, it's back again. He has up your name and all of your contact information, so someone could either call you or go to the website, and the best way is to call and just explain their situation, and that's wonderful. I never knew that you could do that. I always thought a doctor
We can
would have
also, when a person calls, it could be that the services they need might be something that we don't provide,
Right.
but we do consider ourselves main points of referral. So let's say that someone calls and after a pretty good conversation, we determine that meals are really what they need. Then we would try to get them connected with a local Meals on Wheels program or a local congregate meal site if that was appropriate. But if we, after a phone assessment, will feel that there may need to be some home health care services, we'll come out and make an assessment. Even then, it's possible that we make some suggestions and it isn't really necessary for us to admit you. That's fine. We like to be able to put our eyes on what it is that we're assessing. And then the way services are paid for, there are many, many ways. People may have private insurance, a Medicaid managed care program, something like that will pay for services. Often there has to be authorization, but again, we take care of that if it's necessary for us to call for the authorization. Regular Medicare and Medicaid are programs that probably pay for the bulk of the services that we provide. And there are various rules and regulations for each one of the providers that may involve you need to be homebound or you need to have a certain need for certain services. But those are things that, I would need the rest of the afternoon to tell you about. However, our nurses can help go through that to prioritize what your needs are and how they would fit in. Then also, because we're not for profit, we have the ability to request funds through grants, through our annual appeal, and we are United Way members. Okay. So those funds all go to help us care for people who either have no insurance or their insurance does not provide for home health care. At any given time, there can be as many as 25% of our patients that are receiving some sort of assistance with the services that they have. And we do have a wide range of grants that, for instance, would be from the agency Senior Resources. We receive money from the Older Americans Act that provides for people who are struggling with dementia or Alzheimer's at home, and how can we help them manage that disease at home, they and their families. So that's just an example of a kind of grant we might have.
So anyone who's listening shouldn't feel that I definitely cannot pay for this. They should at least inquire. And
absolutely. And for services where people, nothing else fits and they want to pay for the service, but even then they might not be able to afford the full fee, we have a very simple financial that we are obligated to use because we need to show that someone has financial need. Right. But it's not. It's generous enough that a person who's really struggling to stay at home and needs just something as little as help getting in and out of the bathtub, in and out of the shower once a week. Right. We can arrange for an aide to be able to do that, and it can be very affordable for someone. It's a very small investment to make to be able to stay independent.
That's exactly what I was going to say.
Yeah.
I mean, it's a little thing, but you're changing a life. To be able to have someone stay in their home and have a more dignified life as well, just to be able to take a bath, that's really a great thing. You mentioned the Older Americans Act. Are you seeing a lot more seniors that you're serving right now?
Well, we always have primarily served seniors, but because the population that are staying in their own homes has grown, we certainly are seeing those folks. People who are hospitalized, the average length of stay is around 3 days. So if you go in for major surgery, and major surgery today is really different than it was 20 years ago, for instance. You were much more debilitated after surgery. Now, because of surgical techniques and rehabilitation techniques, people recover pretty quickly. So because of that, they get home earlier, and they do sometimes need skilled services for a while. We do a lot of wound care of people, either post-surgical wounds, but also people who have non-healing wounds from diabetes or other circulatory conditions. And if they're seen at the local wound clinic from L&M, it's possible that a nurse would come 2 or 3 times a week to see them in between those visits. That can be a very serious situation, and it does require skilled services to be able to help a person heal.
I think it also relieves a lot of anxiety as well, because I know when you have a wound, if you've never had one before, you're not quite sure. If you're not a nurse, you're not quite sure if it's healing properly. And just to have a nurse come in with all your background and to say you're doing well, it really helps with the anxiety. And speaking of that, you said that you have social workers who might come in. What does a social worker do?
Well, the social workers from VNA really work in 2 areas. One is to help people kind of sort through their finances and figure out, what do they need to provide care for themselves at home or for other services, maybe equipment or that sort of thing. So they can help with plugging people into various programs that might be out there. The other thing that they can do, and as part of that, they can help them sign up for things. Let's say someone does qualify for Medicaid, but they really don't know how to go through that process, then that's something that can happen where the social worker can help them with that. The other side is helping people come to terms with sometimes a chronic or a terminal illness.
Right.
We don't do hospice services as such, but many people elect to spend their last days at home, and they don't necessarily say they want to have have hospice care, but our nurses will be there for them to help them through those days. The social workers get involved in some of that situation to, help people get their affairs in order and be ready for that final time.
And when you're helping people in their homes, when it's an end-of-life issue, you're not just helping the patient, you're helping that entire family come
Yes.
to terms
Very much
with
so.
everything, right? I mean, you think of, we were talking a little bit before the show, and to go into someone's home and to see their pets and to see their possessions and everything that they have, you finally understand someone. Don't you think? You have a whole different, I used to do home visits in some of my other jobs as well, and you really get attached to people because you see them in a whole different light when you go to someone's home. And I always ask people on the show why they chose the career that they did, just because that's an interest of mine, and I think of people who are watching too, because like I said, I just think that nursing is a calling. It wasn't a calling of mine, but I'm so appreciative that there are people like you who just do this valuable service. So, Mary, I'm going to ask you, why did you become a nurse?
Yeah. Well, I actually, when I was in high school, I wanted to be a doctor. And those were the days when sometimes guidance counselors weren't so supportive of young girls making that kind of a decision. And I can remember very clearly having my guidance counselor say, why don't you think about nursing? You wouldn't want to take up a slot that a boy might need in med school.
Wow.
That sort of dates me, but it is accurate.
Wow.
So I kind of in my senior year, I hadn't been the candy striper. I hadn't really had that. I was interested in medicine and healthcare, but I hadn't really thought about being a nurse. I had a friend going into nursing school, and I just abruptly changed my mind and applied for nursing school. I went to a hospital school of nursing so that I was living in a dormitory at the hospital and studying nursing. And when I left there, I went into the Navy. And as a Navy nurse, I got that feeling of being able to see a whole person different than in the hospital. And I know that might seem funny thinking about the military and being in the Navy, but the reason was that I worked in an orthopedic ward, and it was during the Vietnam War. So most of the people who got shot had a bone affected and were on in our ward. And so this 40-bed Marine ward was much like a very large family. They couldn't go home with a big cast on their leg and take time out till they got better. So after coming to a certain point in the ward, they would move to what was called a sleeper ward, or a place that was a convalescent area. And we would know patients up to 6 months, 8 months at a time. So we really would learn about about their families, about their aspirations, something more than that they were just a Marine in the bed. And that made me interested in wanting to care for people in circumstances that included more than just a patient in a hospital bed.
Right. So you were kind of ahead of your time as far as just the whole notion of wellness and the whole person.
That's been the focus of both public health care and home care, has always been looking at the whole person. It's very difficult to go in a home and provide care when you know that the person hasn't had breakfast or hasn't eaten. And although it isn't part of the nurse's plan of care to make a sandwich and a cup of coffee, I will venture to say that most of our nurses have had that time when they've really needed to help with that until something else could be set up.
And I'm so glad you brought that up, because, I mean, we didn't intend for this conversation to go this way, but it's funny how it always seems to happen on this show that here I am at the Pawcatuck Neighborhood Center, and our big focus is food. And people can't believe that 1,400 people come to a food pantry in Stonington, for example. but it's us all working together. You talked about Meals on Wheels, and all the nonprofits in our area really do have to work together so we can give the best type of help to all the people that we're trying to serve. That's an amazing story, and here you are now, the head of VNA. I mean, that's really quite a story.
I've been very fortunate in my nursing career, very fortunate.
Yeah. And Judy, how did you decide to be a nurse?
Well, I've always wanted to be a nurse as far back as I can remember. My mom was a nurse working at the labor and delivery at Lawrence Memorial. And I also went to a 3-year program because at the time that I was going into nursing, that was the way we were told to go. The 4 or 5-year program hadn't really developed as well. And I went to Grace New Haven, which now actually is Yale, and worked in the hospital for a while, different areas, then became a nurse in an office for Dr. Hollister. And when he retired, I wasn't quite ready to retire and ended up going to the VNA. And we had a couple of people who have now left us. One, her name was Judy, and the other one was Addie. And they hired me when I said I really would like to work in wellness, and I've been there almost 15 years now.
So that's your after retirement, another 15
and
years.
I absolutely love the VNA, the people that work there. Mary has always been so supportive in everything that I've done, and I've really counted it a blessing that I had a second career after I left my main nursing career, which is in wellness. You are able to use all the things that you've learned over the years to be able to impart to patients, because as we age, we do pick up a lot of wisdom and knowledge, and we're able to impart that back to the people we come in contact with.
Absolutely
so
true.
I'm extremely thankful that I continued on and did become a nurse like I desired years ago.
You both were lucky that you knew early on what you wanted to do. So is there anything else that, there's one other program that I did want to talk about was the Nurse-Family Partnership.
Yes.
Would you talk a little bit about that, Mary?
Sure. The Nurse-Family Partnership is an evidence-based nursing program for mothers and babies. It's in our organization, it's all grant funded. It's money actually that was set aside in the Affordable Care Act for home visiting to mothers. And in this particular program is over 30 years old. And the nurses meet the mother when she's about mid-pregnancy. That happens to be a time in a woman's life with development through the pregnancy when the woman is most available to make a connection. And nurses are trusted individuals. I always have to say the Gallup poll every year actually shows that nurses are the most trusted in our country.
Wow.
The only year they were ousted from that top position was in 2001 when firefighters were the most trusted.
Just 1 year.
So it's a great program that does more than just health care and supporting the mother and baby's health. It also provides a time for the nurse in, I say her because we only have female nurses in that program, her interaction with the parent and the child are also focused on economic self-sufficiency, helping the mother set a goal to go back to school or go back to work, to lengthen the period of time between pregnancies so that each pregnancy can be a healthy time for the family. And increasing that social and economic self-sufficiency can really change the trajectory of that family's lives.
I've worked with that program and with some mothers who've been in that program, and they have really said very complimentary things about it. And one of the things I hear the most is just to be able to have someone that you can ask questions of. Once you have that trust, and it's again because they come in, the nurses go to the home, and you have that trust, and And another thing is sometimes people think just a first-time mother would need this, but that's not the case.
Yeah.
Because
Yeah.
sometimes, like you said, there's time in between pregnancy. It might be a while since you had a child, and we always want to get better at what we do anyway. So
right.
it's a wonderful program. I did want to just mention. We're wrapping up. This time just flew by. Thank you so
Yes.
much for coming on the
Well,
show.
thank you.
Thank you.
You've been a wealth of information. I don't know if Frank could put Mary's information up one more time, but if you'd like to go on their website or call, I think we only hit the tip of the iceberg talking about all that VNA does. You just are an incredible group, and thank you both for being the wonderful nurses that you are.
Well,
Thank
thank
you.
you.
Thanks for being on our show, and we'll see you next time.